Let's turn our attention to health now. And in the Eastern region, Health Directorate there, they've recorded more positive cases of dengue fever. Well, dengue fever is a mosquito-borne viral infection prevalent in tropical and subtropical regions, well, caused by the dengue virus. It leads to high fever, severe headache, joint and muscle pain, rash, and mild bleeding. You have any of these symptoms, it's a good time to go to the nearest hospital for immediate attention. While most cases are mild, severe dengue can be life-threatening. Well, Ghana Health Service on Sunday issued an alert following the detection of 9 cases in 5 districts in the Eastern region alone. In a matter of days, the Health Directorate says it has confirmed more cases. Eastern Regional Correspondent Kofi Siao has been on that beat for us, and he joins us on the line. Kofi, so we know the Regional Health Directorate just concluded a meeting, and they've been addressing the media on this. What really has come up?
Okay, so MFA, the Regional Health Directorate in that meeting with the media confirmed that they have recorded additional 2 cases to add up to the 9. So, 11 of the cases have been confirmed so far from samples that were sent to Noguchi Memorial Research Center in Kumasi.
The Eastern region is currently managing an outbreak of dengue fever in 5 districts. The districts are Achanse, Achimansa, Birim Central, Birim South, and Birim North. A total of 11 cases have been confirmed by the Noguchi Memorial Institute for Medical Research. The region is expecting a feedback for 57 more samples that are being worked on.
Well, Kofi, you've also been interacting with some residents on this, but before then, he tells you about tracing that is being done currently. How many samples really have they taken so far, and what are we looking at?
Okay, what Dr. Winfred Ofosu said is that they've so far taken about 103 samples of, people they suspect to have the virus. So they have taken these samples and sent them to the appropriate research center for investigations to be conducted on them.
The region currently is managing about 103 suspected cases. So I'm sure many of you have information. Initially it was 9. Some tests have been done again and 2 are positive. So that's why it's come to 11. And like we said, there's still a backlog of tests that are being run at Noguchi. So the likelihood of this number increasing as the day come by is high.
Well, Kofi, you can also tell us what residents have been saying. Is there a state of fear, state of panic? What exactly have they been telling you?
Okay, so in the afternoon I told you they confirmed to me that they heard about the news in the media, both social and traditional media. So they are only waiting on the Ghana Health Service, even though they've heard there is no cure, to come up with the safety precautions so that they can all adhere to in order to protect themselves from the virus.
I learned the Ghana Health Service has put in place in collaboration with the National Emergency team to outline strategies. And in my readings, I realized there is no known cure, but the patient is supposed to stay hydrated and live a healthy lifestyle and also prevent mosquitoes bite. I'm scared because of the weather, a lot of people are also developing symptoms of malaria. But the only thing that gives me joy is it is not transmitted from persons to persons, but it is only through mosquitoes and it is not contagious.
Well, so a resident there interacting with my colleague Kofi Siao on the situation and his knowledge about the dengue fever. I think it's a good time for you to also apprise yourself in terms of what you should look out for when it comes to the dengue fever. It's in the Eastern region now, but let's head there and speak to the Deputy Eastern Regional Health Director, Dr. John Ekotu. Many thanks for your company here on Newsnight. So listening to that press conference that happened a while ago, I hear that there's a backlog. You still have some samples that are with Noguchi now, and 103 samples so far that you have. You've had 11 cases. Do we have the entire results for the 103 samples, just for clarity?
Okay, so good evening, and thanks for inviting me to this conversation. So the 103 are people the region has suspected so far. That once we suspect, we take samples to confirm. So of the 103, we have received samples for 56, okay, of which 11 are positive, okay. So we are waiting for results for the remaining samples. Yeah, but again, we are not. Once we suspect you, we go ahead to manage. We follow you to make sure you are well, because all persons whom we suspect are persons who fit a specific case definition. So we're not leaving anyone behind. Yeah.
Well, so at what point do I become a suspect? Because I'm told that many of these patients or samples that you took, they were being treated for malaria for a very long time before it graduated to this level. So how do I know if I'm a suspect? If I've been to any of these 5 districts, we'll talk about the districts itself. How do I know that I'm a suspect?
Good. So the presentation of dengue fever is just like malaria, except that the muscle pains are quite intense than malaria. The headache can be quite intense, and the disease is prolonged than malaria. So we're expecting that once someone is treated for malaria and the third day the person is not well, the person should be investigated for dengue fever until proven otherwise. Okay. But again, for the communities that we now know that there's transmission going on, the case definition for a suspected case is anyone showing febrile illnesses within 2 to 7 days with specific signs of myalgia, that's muscle pain, joint pains, rashes, and any sign of bleeding from the gums, the nostrils, or the mucosal surfaces. And if the person has done labs and we're able to see a drastic fall in the white blood cell count, we suspect you to be dengue fever until proven otherwise.
Okay, so if let's talk about the 5 districts that you've confirmed cases of this dengue fever so far. Which districts are we looking at? And if I've been to any of these districts, what should I do?
Good. So the districts are Achiase, Achimansa, Brim North, Brim South, and Brim Central. If the 11 positive cases are from Achiase, Achimansa, Brim South, and Brim Central, we are yet to receive the feedback from samples we collected from Brim North. Yeah.
Well, so if I've been to any of these, Achiase, Achimansa, Brim North, South, and Central, is there anything in particular I ought to do?
Yes. So once you've been to these districts and you are experiencing symptoms, i.e., fever, general malaise, headache, vomiting, abdominal, any symptom that looks like malaria, we advise you to get close to the nearest health facility and let the health workers know that you spend a number of days in these communities and you hear that there's dengue, so you are reporting themselves. The health workers know what to do. I heard my brother said earlier, the management is mainly supportive. So the clinicians will look out for any other conditions that has the potential of worsening your case if you have dengue and manage you. Then we encourage you to take a lot of fluids, eat very well, have good rest, so the body can fight it. There's a potential for it to get serious, and that is where you may need inpatient management, where we may have to do some IV infusions and other. If your blood is you can have anemia, drastic anemia because of a fall or hemolyzing of the red blood cells, then you may need to be transfused if possible.
Well,
so it's important to get close to the health facility.
Okay, Dr. Otu, so we have 11 cases now. I know you're expecting more positive cases. Is it a situation that the Ghana Health Service has under control?
Yes, so far we are very well on top of the situation. Currently, in all the districts and in fact the whole region, but with specific focus on the district infected, we are ramping up our social mobilization and risk communication with the intention of getting everybody to know that we have dengue in the district, and this is how it presents. And when you have signs and symptoms, it's important to get closer to a health facility. Again, we've set up our health teams to, we've oriented them on exactly what they should do so that everybody who presents with signs and symptoms, we don't miss it, and we'll be able to give them the best of care. We've provided them with the basic logistics so that they'll be able to manage very well. Headquarters is making plans to add on to the logistics so that we'll be well secured to. Because
you may be putting these preparations in place, Ms. Otu, but you may be putting all this in place, but the source really is that mosquito that we all ought to fear. Really, how are we preventing that?
Yes, so that's the biggest challenge, because now the rainy seasons are here. The mosquitoes, the environment influences the mosquitoes. So as part of our education to the community, we are also informing them that it's important they put in all measures to prevent mosquito bites, both at the personal level and in the community. We've engaged the chiefs, we've engaged the assembly, we've engaged opinion leaders, and the education is ongoing. We had meetings with the assembly to explore the possibility of expanding the indoor residual spraying that is ongoing. But largely, if you talk to the people, they are being bitten more in the farms. These areas are farming communities. So we are largely stressing on they wearing protective clothing and using insecticide and insect repellents as much as possible. Then we are stressing on the management of the environment, weeding, managing of refuse dams, covering of water receptacles, and taking care of all breeding sites, areas that mosquitoes can breed near the homes, so that we reduce the mosquito population as much as possible.
We are grateful. That's Dr. John Eko Otu, Deputy Eastern Regional Director, Health Director there, talking to us about the dengue situation in the Eastern region. Now, the number of cases, 11. It tells you why you need holy insecticide spray and coil for your protection at this point.